Yeah, I'm ready. Ready? Okay, I'd like to call the December 10th meeting of the Human Services Committee to order. First order of business is approval of minutes from the September 29th budget review and the November 12th meeting. Do I have a motion to approve those minutes?
So moved.
Do I have a second?
Second.
Thank you. All in favor?
Aye.
It's approved. Next up is privilege of the floor. Do we have anyone here to speak to the privilege of the floor? Anyone for privilege of the floor?
Yep, we got one.
S-
coming down.
Oh, we do? Oh, okay.
Oh, okay.
Oh,
Sorry. Sorry.
Okay, seeing nobody for privilege of the floor, we will go to the first proposed resolution, which is to confirm reappointments for the Chautauqua County Office for the Aging Advisory Council.
By the time I got here, you're just in time.
Yeah, exactly. Perfect. Thank
Good
you.
evening, everybody. Dana Corwin, Director, Chautauqua County Office for Aging Services, here to do a reappointment to our advisory board. We have the members listed. Not sure about that one. And to give you a little bit of a background about how we choose folks, they have to be nominated and reviewed by the current council, and then, of course, submitted by the county executive and then approved by the groups here. And we tend to keep a map, and I didn't make one for everyone, but you can kind of see the large circled areas are the ones we'll be reappointing, and you can see that we try to recognize or represent large portions of the county. The one in the circle right here is one of our members that will be retiring at the end of the year, and that will come later into the year 2026. So we have 5 people put forth for a spot on our advisory council: Mr. Laverne Terrell, Miss Ann Sullivan, Dr. John Hamels, Dr. Lynn Bayless, and Miss Sarah Goebel. And these are all subsequent terms for them. They've been serving with us for at least one term before.
Nobody else was interested?
Well, we keep from 5 to 11, and with our current staff, I'm also on the board. We have 2 legislators on the board, as well as our nutrition staff, which are required. Everybody outside of that, we have from 5 members to 11 members. So typically, we do have a fair, good amount of interest.
Okay. Any questions? All right, all in favor?
Aye.
Aye.
All right, thank you.
Thank you. Resolution number 2, to continue agreement with New York State Department of Health for Bathing Beach Water Quality Monitoring and Notification Program.
Good evening, folks. Jessica Worsley, Director of Environmental Health for Chautauqua County. I realize you may be surprised why we're talking about bathing beaches right now, given the weather outside. This is one of those sort of housekeeping resolutions to continue accepting money from a New York State funding source that helps us to employ, usually we employ a beach intern to help us go around and collect water samples and do the monitoring for our different public swim beaches. This is specifically for the Lake Erie beaches, this grant money, but we have been able to utilize that intern to cover the other beaches and the other lakes that we have in the county as well. And it's one of those grants that we don't actually apply for. We're just given and told how much money we're going to get each year. So I need to renew this resolution because it was originally created in 2003. So we're well past the 10 years that the county likes to see these resolutions renewed.
Any questions? I've got a couple.
Sure.
Do we get any other money for any of the other beaches? I mean,
We get reimbursed through our New York State article reimbursement, just as a county health department doing beach things, we do inspections. But as far as the actual testing, we don't get reimbursed for any of that actual testing.
okay, is this typical of what we get, the 10,100?
That's been pretty consistent. Usually we're given multi-year contracts. This last one was a 4-year contract, so the September of '26 will be the last year of this multi-year, and then we'll be told, next season, what our new annual allotment will be. The money
Oh,
does
okay.
originally federally. It's from the Great Lakes Restoration Initiative, so we'll see what that looks like in the future.
How many beaches do we have in the county?
Um,
I mean,
So we've got.
all
so-
your fingers and toes? or-
Yes, absolutely, yes. Because people forget, we've got beaches on Lake Erie, on Cassadaga Lakes, on Chautauqua. We've got a few random ponds in the county that are associated with children's camps or campgrounds.
Finley Lake.
Bear Lake doesn't actually have any public beaches, so that's the one. But yeah, Finley has a couple of campgrounds, so there's quite a few. And that's part of the, part of the time that is required for sampling is just driving around our county collecting these samples. The actual sample collection doesn't take very long, but getting from Mayville to Finley Lake, we're smart and we cluster our beaches and we do, cluster so we're not driving all over God's creation for one day, but, it is
Well, I
a lot of
imagine you
driving.
respond too to, can you come here tomorrow? Because,
We typically work on a schedule of, we'll set the scheduled day because we don't want to necessarily cherry pick weather event days. So we typically set a schedule that on Mondays we sample this beach, on Tuesdays we sample this beach, to try to give us a better idea of what things look like without cherry picking weather days. And, if we just went sampling every day that was sunny and beautiful and calm, that's not really gonna tell us anything. So we try to pick a day of the week and stick with it. Every once in a while, things like July 4th throws off our schedule because we can't work that day and we can't run samples. But that's our general approach.
okay. Anything else?
Mr. Chairman, you might ask Jessica to explain what they test for.
Sure. We test for E. coli bacteria. E. coli bacteria is an indicator of fecal pollution. So that's the idea, is our samples are meant to indicate that if those beaches are receiving any sort of fecal pollution from any sort of outside sources. The samples are collected on, let's say, a Monday morning, and they take 24 hours to process. So on Tuesday morning, we have the results for those samples.
And
Does
what do
that
you,
come up very often, that you get contamination in your sample?
It's largely when you would expect. Under the calm, beautiful days, typically things are wonderful and fine. Where we see high levels, or when we see high levels, is following rainstorms or any kind of stormy activity. Rainstorms are gonna sweep those creeks and different things and wash a whole bunch of stuff down into the lakes. And so when you see that sort of turbid, chocolate milk looking type of water, that's typically when we see increased bacteria counts. But on your general days, our beaches for the most part are beautiful. It's just following the storm activity typically.
You do this every Monday, you said? Every Monday you go get a sample?
So we do, it's, different beaches are on different days of the week, but for the Lake Erie beaches, we typically sample Lake Erie beaches on Monday. We sample Cassadaga beaches and a couple of the Lake Erie beaches a second time on Tuesdays, and then on Wednesdays, we we hit Chautauqua and Finley Lake
So they're all
areas.
done at least once a week?
Not all of them are done once a week. It depends on sort of the risk level at the beach and how it's used. So some of the, and the nature of the water. So some of the smaller beaches, like the ponds, they don't really have any big inflows. So they're a lower risk beach, so we'll sample them maybe every other week, maybe even once a month. One of the campgrounds in the county is a very, very small pond that you would be surprised that they even have people swimming just because it's small. So that one's doesn't present a high risk. They don't have a lot of outside contributions that we're concerned about. So we keep an eye on that one, but we don't sample it as regularly as we would sample something like a children's camp or a very popular publicly used beach.
Seems like an awful lot of work for $10,000.
It is an awful lot of work. That's why we use an intern that we can keep at minimum wage.
And Jessica, the E. coli that you sample for is a primary indicator of human waste, but it's also an indicator of other sources.
Sure, it's E. coli is in the bellies of all warm-blooded animals. So cows, birds, we do see some beach closures that are in large part the result of goose droppings. If some of the beaches don't get cleaned up and there is a lot of goose debris around, that can get washed in, you know, think of all of the goose evidence that's left on a beach, and then a rain comes and washes all of that into your beach area. That can throw your numbers high. So it's not necessarily an indication that there are bad septic systems or bad sewer capacity or anything, but it's just another source of contamination. It's a fun world. You guys
Yeah.
can come on
Yeah,
anytime
right?
you want.
I know, right?
I'm very familiar with goose evidence, as you say. Anything else? All in favor?
Aye.
Aye.
Thank you.
Now we have proposed resolution number 3, continue agreements with Health Research Incorporated to receive public health emergency preparedness funding.
This is another sort of housekeeping resolution that we're just looking to update. We receive money through federal originate as federal sources through the state that come to us for our public health emergency preparedness programming. These funds are largely used on staffing costs, but we also use some on training and traveling fees. There's a lot of training that's involved in our public health emergency preparedness program. You know, the whole idea is staying connected with our community partners and, you know, different state partners should we need some resources or assets if and when something bad happens. So this resolution is meant to just allow us to continue accepting those funds.
Okay. Any questions? All in favor?
Aye.
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 Thank you, folks.
Thank you.
Thank you.
So on the agenda, it brings us to a discussion on the CPS update, but we do have a late resolution that I believe everyone has on their desk regarding appointments. And I believe Carmelo and Trish are going to speak to this anyhow. So if you could come forth. We'll do that first to confirm appointments for the Chautauqua County Community Service Board.
Carmelo Hernandez, Commissioner of Mental Hygiene and Social Services.
And Trish McLennan, Deputy Director with Department of Mental Hygiene and Social Services.
So this here is to, Trish has the list to confirm the members for our Community Services Board. So this board is required by state it helps us with our local governing unit and helping us identify gaps and possible services that we could utilize within the community.
And we have spent the last few months really looking at the board and looking at really making it a meaningful board rather than check a mark and have a board. So what you've got in front of you is quite a few new names. This has not been a super active board, even though it should be. So now going forward, we've got the right people, the right places, and we have actually met with all these folks in a meeting about 3 weeks ago, something like that, just to explain what the commitment is, why they were asked to be part of this board, and did they wish to commit. So after the meeting, they were given the opportunity to submit an application to our county executive, and that was reviewed, and that's what you have below. So I believe the list you have includes, and if you have any questions about any of these folks, glad to explain why we chose these people. Christopher Wachowski, Kelly Burkhouse, Philip Lombardo, Tracy Gates, Kimberly Eklund, Ray Manning, Thad Lund, Melissa Rivers, and Lori Reynolds. We're continuing to have Marie Karuba on it, who has been serving on it for, I want to say, over a decade, probably 15 years or more. And Ellen Maternowski, she's been serving on it for quite a long time, is an excellent member. Amanda Giesing is a newer member, but has been a member for several years now. And John Anderson is a very recent member in the last year. And then, of course, Carmelo, myself, and Rachel Ludwig are also serving on it. Are there questions or names on
Can I
here that
just
you're not familiar?
ask
Yes,
a
please.
question? It's evident that 3 of them do not live in Chautauqua County. Do they work in Chautauqua
So
County?
yes, so
Okay.
the requirement and the bylaws are being updated. It's a great question to include this. New York State allows one or the other. So either working in Chautauqua County, meaning Tracy Gates is a great example of that. So Tracy Gates, if you're not familiar with who she is the new CEO for UPMC Chautauqua. She still is residing outside of Chautauqua County, but her life and the reason we want her on the board is because of our local hospital. To have Betsy Wright in the old days, as you folks may remember, used to serve on this board quite a long time ago. And UPMC has not been represented since
Betsy
it
left.
became UPMC. I guess I'll say it that way for you. So this is real positive. Ray Manning is a similar situation. Raymond Manning is the CEO of New York Medical Center, which is the old Lakeshore Hospital, which is becoming Behavioral Health Hospital. So another key player. These folks need to be helping to inform, and we need to be helping to inform how care is being delivered. So that was a great question. So it's either you're either asked because you live in this county, or you're asked because you contribute professionally in this county.
Okay. And this really hasn't been active since COVID, as I
It's not,
understand?
it's been more like a share what we're doing, I guess is the best way to say it. So,
Report out.
Yeah, report out, rather than really impacting how decisions, really what they should be doing is helping to develop and guide our local services plan. And that wasn't even done prior to COVID. So we've talked about that, we've shared that with what that means, what the commitment means, including the subcommittees. There's 3 subcommittees that go along with the Community Services Board. And I've got to say, I was pleasantly surprised, and a lot of these folks, as you can imagine, are very active already professionally, and to say yes to a committee it's a big decision to make. You know, for Tracy Gates or Kimberly Eklund, Mayor of Jamestown, to say yes to this means it's that important, that they want to have an influence, positive influence in this county.
How often will they meet?
How often? Monthly.
Monthly? Okay. Any other questions? All in favor?
Aye.
Aye. Thank you on that. Thank you very much. And now that brings us to our CPS discussion. I asked Carmelo if he could join us. I know we've recently gone through an audit, and obviously this was brought up over a year ago and
Yes.
had a lot of attention, so we wanted to update and see where we stand now, so.
Oh, most definitely. Thank you for inviting me. So the audit was conducted by the Bonadillo Group, and this was right as before we, they didn't even start. They started once we got integrated, once we became integrated. So some of the things that we found, they found as well. And this is before the great work that John Anderson, Lori, and the entire team has done. So what they found, because they went all the way back and they looked at all our records, there were documentation gaps of 40% of our cases. With the timely SCR history checks, progress notes timeliness averaged 65%. And these are going to sound negative. And this is before Lori and them started working and before the contract was actually finalized. So they were able to look at a specific time frame. So what they found was that there were significant improvements in our metrics 2024. 0 caseworkers above 15. Strong safety assessment compliance, we were 100% at 24 hours and 85% 7-day. Well, we're still working on that 7-day, trying to get it to 100%, but a significant improvement from the 40%, as you can see. Preventative services and foster care, high compliance rates in our family assessment and safety plans, our casework contacts and permanency efforts, and this was a big one that was, for us, it was good to see. For counties comparable to our size, we are competitive starting salaries for casework, the second highest among comparable counties our size. So it may look like we start low, but we, as longevity, we creep up and we are super, super competitive. And when they average it out across New York State, it was really New York City, the one that was really, I mean, it's New York City, so as huge as they are. So they found that we improved our contracts, we improved the service delivery, and also maximized how we were using our caseworkers and our CMWs, and also our federal audit for our services team was actually amazing as well. And that was one of the ones that OCFS is gonna been in contact with Lori, Melissa McMahon, when she was here, in terms of how now we can be actually one of the staples, because New York City failed and another county didn't do so well. So we were chose number 3 for the feds to come and audit us outside of this audit when it came to our services team, because we did so well and how we utilized our CMW. So overall, it was good. In October, we met, we went over the draft, and then it was finalized beginning of November. But we did find some areas where we need improvement, some policies that we need to tweak and change, like on-call and night shifts, and how we go about that. Some policies were outdated, and also our, you could call it our electronic health record, but connections was given to us from the state, and then we also use Northwoods, but how can we maximize and really integrate it, and where do we need to do it? Because there's some new features and the connections that the state has put in, and then there's features in the Northwoods, so it's more potential to really maximize our contracts and where we're putting in our money and our finances.
Okay. So you said that, you know, there's been improvements from when to when?
The improvements, so I'll be honest, the improvements, I'll say January 2024 to present.
Okay. So it encompasses the area that was in question, so to speak.
Absolutely, absolutely, and it's a program like any of our programs. It's a program that you gotta constantly assess and constantly look for ways to improve. There's always going to be an area for improvement, but with the changes that come out in the state and new regulations, and also changes in possible staff and changes in service delivery, so there's always criteria that we have to watch, and I think that's the biggest takeaway from what we've seen here.
How are we in staffing at this point?
Staffing right now, doing well in the sense of what we have available. We are looking at how we can improve our CMWs, and I think we do need another Spanish-speaking worker. It's been a year, and we haven't been able to, we had an employee that had to go downstate, but we haven't been able to fill that slot, which was an important slot that we have for our Spanish-speaking.
When you say CMW, what's?
It's a case manager.
worker.
Yeah.
Okay.
So, and what they do is they don't conduct the investigations, but they're a critical part into the investigations because they help out with the transportation to the clinics. They any clothing, anything, furniture that they may need within the home. So they're heavily involved and assist the caseworkers. So the caseworkers is doing the investigation, and a lot of the basically the running around the CMWs are helping the caseworkers.
So we need a Spanish-speaking
Yeah,
caseworker.
we need a Spanish speaking. It's been hard to recruit a Spanish speaking.
What are we doing to recruit? I mean, just the human resources?
Oh,
is-
well, as of this afternoon, I'm waiting to receive the canvas, so it went out, so hopefully we have one there. So we're hopeful on that one, so we should know by tomorrow morning who's on the list. I know the
Oh,
test was given, so we're hopeful.
Okay. All right. Any questions from anyone? Okay. I appreciate that update. And, oh, I did have one question. The federal audit is done every year?
The federal, so the way it works is New York State gets audited, and OCFS, it was Sullivan County, New York City, and OCFS, Office for Children and Family Services, said, we want you to also do Chautauqua County because of the work that we were doing in our services side and our CMWs and how well we were scoring. So the audit came back, OCFS, some changes coming in, and they are gonna allow us to help them in being able to rectify the findings that the state received, because they got audited by the federal government.
Okay. All right. Okay. Nothing else? Appreciate the update. Thank you very much.
Thanks for your time.
Yeah.
No worries.
Drive safe. Happy holidays.
That's right.
Yeah. At this time, there's any other? Is there any other? Other?
I make a motion, we adjourn?
We have a motion to adjourn. Do we have a second? We have a second. Are we all in favor?
Aye.
Yes. Aye.
Phil already left.
Phil said yes. Okay, we are adjourned. Thank you.
Oh.
You didn't get the vote.